Dear viewers, welcome to the channel Bharat's Pharmacy. So in this video, I'm going to explain about absorbable gelatin sponge. So what is absorbable gelatin sponge? These are a small sterile surgical sponges which is prepared from a specially treated purified gelatin solution. Each sponge is a hemostatic device. It will be prepared small pieces, and each piece it acts as a hemostatic device. It absorbs the blood or exudate from the wound site, and it is having the capacity. It absorbs many times of its own weight of whole blood. And these sponges it can be implanted during surgery, and it will be completely absorbed within 4 to 6 weeks without producing any toxicity. So that is what the major advantage with absorbable gelatin sponge. So this is commercially available with various sizes and shapes, and these are some examples of this absorbable gelatin sponge. So depend upon the need, the size and the material, you can select. Commercially available product name is gel foam. It mainly absorbs the blood and exudate, and it provides the area for the clot formation. Uses a hemostatic device which is used during as well as following surgery. Preparation. This is mainly prepared by adding a small percentage of formaldehyde to a warm solution of good quality gelatin. So gelatin has two types of gelatins are available. One is gelatin A and gelatin B. So gelatin A is the one which is prepared by acid hydrolysis, and gelatin B it is prepared by the alkaline hydrolysis. And this solution, when you stir it, it will be producing a foam. How when it is dissolved in water, it is producing foam. So since it's a gelatin is a protein, when it is dissolved in formaldehyde solution, it is produced enough amount of foam, and that foam alone can be separated, and it will be freeze dried. And this porous product, it cut into pieces of suitable size depending on our requirement, and it is sterilized by dry sterilization at 140 degrees Celsius. Properties: it is water insoluble, off-white, non-elastic, porous playable product. It may be cut without frying or rubbing and is able to absorb and hold within its interstices many times of its own weight of blood and as well as the other fluids. When this is not used in the excessive amount, it is absorbed completely with little tissue reaction. This absorption is completely dependent on many factors, mainly the amount of what we are using and the degree of saturation with other fluids and the anatomical site of use. When it is placed in the soft tissues, it is usually absorbed completely within 4 to 6 weeks without inducing any excessive scar tissue. When it is applied to the bleeding nation, rectal or vaginal mucosa, it's getting liquefied within 2 to 5 days. So in another video, I'll explain about gelatin liquefaction soon. Liquefaction is the one, since it's a gelatin is a protein, any microorganisms when it is contact with gelatin, it starts secreting an extracellular enzyme called gelatinase. So this gelatinase enzyme, it acts on this gelatin and it breaks down into smaller unit. So that's the reason where there is a microbial attack or microbial infection is possible on the wound site or in these areas of the rectal or vaginal mucosa. So the gelatin sponge, it should be dipped into an antibiotic solution. After that, it can be used for a hemostatic device material. Or else, because of the microbial attack, it is getting liquefied before the purpose is getting solved. So main mechanism of action, when it is applied directly on the bleeding surfaces, it arrests the bleeding by formation of artificial clot, number one, and it is also producing a mechanical matrix that it facilitates the clotting. The clotting effect is due to release of thromboplastin from platelets, and when platelets is entered into the sponge and it become damaged by the contact with the walls of its myriad and interstices. Because during the process of freeze drying, the surface of gelatin sponge is not smooth. Due to this rough surface, it easily punctures or it ruptures the platelet it releases the thromboplastin enzyme. So the produced thromboplastin, it interacts in the presence of calcium that it converts prothrombin into thrombin. So this thrombin is necessary for the conversion of fibrinogen into fibrin. This spongy physical property of gelatin sponge, it hastens the clot formation and also it provides structural support for the formation of clot. So the gelatin sponge, which is prepared during the process, it is not a uniform or smooth surface. It is produced at a very rough surface. So by the time when it contacts with the platelet, so it ruptures and it produces thromboplastin. So this thromboplastin, in the presence of calcium, so that it converts this prothrombin into thrombin. So this takes for a minute, and after that, this thrombin, it acts on the fibrinogen, which is a soluble fragment which is available in the blood, and later this fibrinogen is getting converted into fibrin. So today, commercially or technically, since the medical field is very strong, so even we have the solution of thrombin. So to speed up the reaction, to speed up the clot formation further, so what you can do, you can take absorbable gelatin sponge and directly can dip into a thrombin solution. And on the site of use, when you are using thrombin dipped absorbable gelatin sponge, still the hemostatic device action, it will be quite faster than compared with plain absorbable gelatin sponge. So this gelatin sponge, it can also be dipped into a solution of antibiotic or thrombin, or even sometimes with saline for emollient effect. So the main caution or the main disadvantage of this double gelatin sponge. So this material is not suitable for septic wounds as it is a plain absorbable gelatin sponge. But if you want to use on these areas, it should be dipped into an antibiotic solution and it can be used. To test for standard, the digestibility in acid pepsin solution. So every batch of the product at the time when you manufacture, you have to assess the quality of the gelatin. So for performing this assay, you take a particular gram of gelatin, put it into a pepsin solution. You stand for a stated period of time. Based on the digestibility, you can assess the quality of gelatin. So every product, every batch of the product, it should be assessed for the quality of gelatin which is produced. So main uses, it is used as a used dry or saturated with a sterile sodium chloride solution, and it is indicated in surgical procedure as a hemostatic device. When control of capillary, venous or arterial bleeding by pressure, ligature and other conventional procedure is either ineffective or impractical, this is the material it is widely used. Although it is not necessary, it can be used with or without thrombin to obtain a hemostasis. When you need to speed up of the reaction, this thrombin, you can dip this absorbed gelatin sponge into a thrombin solution. But since it's having the capacity, it absorbs many times of its own weight. After dip into the solution, you press absorbable gelatin sponge against the container wall so that the excess thrombin solution may be removed from the absorbable gelatin sponge. Or else it takes more than the required amount of thrombin solution. And as like a saline or antibiotic solution also when you dip, you press against the container wall and so that you can squeeze the excess amount of this saline or antibiotic or it may be thrombin solution. And after that you can apply it to the right side. And during opening of the process, if you're handling with aseptic handling by wearing gloves or in front of laminar airflow, the material which is unused, the remaining portion, maybe you can use it for a second time or else it's a general advice for safety precaution. The unused material, it should be discarded and re-sterilization should not be attempted. And thank you. Subscribe this channel to get more updates about the topic. Thank you.